Everybody hi. Traditionally, Helicobacter pylori has been viewed as a straightforward pathogen that should be eradicated upon detection. However, contemporary science increasingly supports a more nuanced view. This long-standing inhabitant of the human stomach appears to act less like an invader and more like an ecological participant, with effects that depend on host factors, strain, virulence, and the broader macrobiome. Viewing the human host as a holobiont, a microscopic body combined with a complex macrobiome, is essential to understanding Helicobacter pylori. Within this ecosystem, Helicobacter pylori is merely one of many players, colonizing roughly half of the global population. Like other ancient human-associated microbes, it possesses both beneficial and pathogenic properties, contradicting the earlier narrative of a universal villain necessitating removal. Pathogenicity appears to be driven primarily by specific virulent strains carrying factors such as CAGA and VACA. While these strains markedly increase the risk of peptic ulcer disease and gastric cancer, they are distinct from less pathogenic variants. Unfortunately, virulent strains remain imperfectly characterized and difficult to distinguish in routine practice. Consequently, eradication therapy is often applied indiscriminately, even to carriers in whom Helicobacter pylori may be an innocent bystander rather than the driver of pathology. There is growing concern that this blanket eradication disrupts the microbiome, contributing to immune dysregulation. Epidemiologic data suggests that Helicobacter pylori modulates systemic immunity, potentially protecting against allergic and atopic conditions. This aligns with the hygiene and disappearing microbiota hypothesis, which links the loss of ancestral microbes to rising autoimmunity. Furthermore, post-eradication dysbiosis in the gut has been associated with metabolic disorders and inflammatory bowel disease, prompting interest in microbiome-sparing strategies. Moreover, the mass use of multi-drug protocols has accelerated antibiotic resistance, transforming a treatable infection into a global public health challenge. In this context, a reflexive eradicate at any cost strategy increasingly appears to be an imprudent error rather than cautious standard of care. While major guidelines rightly recommended treatment for clear indications like peptic ulcers or MLT lymphoma, the medical community is gradually acknowledging that the one pathogen, one disease model is insufficient. The future of management lies in precision medicine rather than uniform treatment. Emerging approaches include molecular testing for virulence factors, susceptibility-guided regimes, and careful risk-benefit analysis of microbiome consequences. In the era of patient-centered care, clinical decisions must focus on the specific individual rather than the more presence of the microbiome. the debate has shifted so significantly that some experts even theorize the future reintroduction of Helicobacter pylori equivalents to restore ecological balance, underscoring a profound shift toward a host microbiome environment perspective in preventive medicine. Thanks for likes and sharing.